Good health and well-being is the state of being physically, mentally, and socially healthy. It's essential for a happy and fulfilling life. It allows us to enjoy activities, have positive relationships, and be productive. Good health and well-being is essential for achieving overall sustainable development. It allows individuals to participate in economic and social activities, and it is a prerequisite for other goals such as decent work and economic growth, reduced inequalities, and sustainable cities and communities. Good health and well-being is influenced by a variety of factors, including genetics, lifestyle choices, and access to healthcare. However, social and economic factors such as poverty, lack of access to education, and discrimination can also play a major role in determining an individual's health outcomes. As citizens in Sri Lanka, we know that healthcare service is almost 100% free. Therefore, one might think that when it comes to good health and well-being, Sri Lanka has successfully achieved this goal. But the reality is that Sri Lanka is currently facing an economic crisis, which has led to increased financial struggles for many individuals and families. This has made it difficult for many people to afford the costs associated with traveling to see doctors and access healthcare services. As I mentioned previously, access to healthcare is a crucial component of good health and well-being, and it is essential for preventing and treating illnesses. However, when people are struggling financially, they may be less likely to seek out healthcare services even when they need them. So, our team is trying to suggest an IT-based solution to address this problem so that citizens in Sri Lanka will be able to access the free healthcare service provided to them.
Okay, let us see whether good health and well-being is listed under goal targets. Of course, yes. Good health and well-being is listed as one of the 17 Sustainable Development Goals, SDGs. It is listed under goal number 3. Ensure healthy lives and promote well-being for all at all ages. This goal aims to ensure that everyone can access quality healthcare services, reduce preventable deaths and diseases, and promote mental health and well-being. Good health and well-being is a very important sustainable development goal for Sri Lanka. It is important for a variety of reasons, includes mental, emotional, spiritual well-being. This is essential to the health and prosperity of any nation, particularly in times of crisis. In Sri Lanka, the lack of medicine has created a dire situation, and it is essential that citizens maintain good health and well-being in order to weather the storm. Good health is needed to ensure that the country has enough people with the energy and capability to continue to work, provide services, and support the economy. Good health to ensure that citizens are able to resist diseases and illnesses which can further compound the current crisis. Furthermore, good mental health and well-being are essential to ensure that citizens can cope with the difficulties of the situation and stay motivated to help the country move forward. Sri Lanka is recognized globally for its health achievements and is one of the top performers in SDG 3. However, the country still needs advanced interventions to smoothen the drive towards basic outcomes. Even though Sri Lanka is free from a few infectious diseases like malaria, some of the diseases like HIV and dengue, particularly, we consider as examples, are on the rise. Our country can further sustain and accelerate its progress through the development of a national action plan on health and well-being.
In Sri Lanka, a number of ICT-based solutions have been developed to ensure healthy lives and promote well-being for all at all ages. One of these solutions is the e-health system, which was developed by the Ministry of Health, Nutrition and Indigenous Medicine. This system enables health workers to access patient data such as medical history, laboratory test results, and other health information from any location. This helps to ensure more accurate diagnosis and better care for patients. Another ICT-based solution is the mHealth platform, which was developed by the Sri Lankan government. This system allows health workers to access patient data and medical records through mobile phones, allowing for better and more efficient communication between health workers and patients. This platform also provides health workers with timely updates about disease outbreaks and other health-related news, helping them to respond quickly and efficiently. The Sri Lankan government has also implemented a telehealth system which allows health workers to connect with patients through text messages, telephone calls, and video calls. This system enables health workers to provide better care and advise patients and to monitor their progress and medical conditions more closely. The government has implemented a system for monitoring and evaluating the performance of health workers, which helps to ensure that they are providing quality care. This system also helps to identify areas where improvements can be made and to provide feedback to health workers on their performance. Overall, the government of Sri Lanka has implemented a number of ICT-based solutions to ensure healthy lives and promote well-being for all at all ages. These solutions have enabled health workers to access patient data more quickly and accurately, to provide better care and advice to patients, and to monitor and evaluate their performance. There are a number of existing ICT-based solutions internationally that can help achieve this goal as well. For example, the United States Centers for Disease Control and Prevention provides an online platform that offers information on a range of health topics including nutrition, physical activity, and mental health. Another example of an ICT-based solution is the use of remote patient monitoring systems. These systems allow healthcare professionals to monitor and track a patient's health in real time. Without the need for a physical appointment, this can help reduce the workload on healthcare systems and enable timely and appropriate interventions. Additionally, these systems can also be used to track lifestyle and behavior changes and provide tailored advice and support for individuals. In conclusion, there are a number of existing ICT-based solutions that can help ensure healthy lives and promote well-being for all at all ages. These solutions can help reduce the workload on healthcare systems, provide access to health information and resources, and allow individuals to track their lifestyle and behavior changes. Ultimately, these solutions can help to achieve the UN Sustainable Development Goals.
In order to answer the current challenge faced by Sri Lankan citizens, we introduce a system that gives access to almost all the medical services that can be done using the internet. So, let's see the key features of the system that we suggest. The patients are able to schedule appointments through the system, check the availability of doctors and nurses, check clinic schedules, check the availability of medicines in a particular hospital, carry out e-channeling, call for an ambulance in an emergency, get notified about any strikes related to doctors, nurses, or any other relevant medical staff, or even access to a FAQ section where they are able to view and read frequently asked questions. Therefore, it isn't wrong to say that the system that we suggest is an all-in-one solution for the patient to improve their good health and well-being. Next, let us see what challenges we have to face when implementing such a system. In Sri Lanka, there may be limited infrastructure in place to support e-channeling services such as inadequate internet connectivity, lack of computers and other technology, and limited access to electricity. Also, people might not have the necessary literacy when it comes to handling digital devices. In other words, this is known as digital literacy. Because of the lack of digital literacy, people might be reluctant to use such system. When it comes to using an IT-based system, people have to spend on data charges, and some people might not like to spend on that. Therefore, for some people, this might not be the best way of doing it. Additionally, there can be certain cultural barriers, such as people might think that the job is not done properly when they meet the doctor via a computer, and some people might not like to switch on their cameras and have a conversation with their doctors. Not only that, people might be afraid that their private details are misused because these things have happened previously due to poor security controls and maintenance. In conclusion, implementing IT systems to develop good health and well-being is challenging and requires addressing multiple issues. However, it is clear that the use of IT systems in healthcare can greatly benefit individuals and communities. By taking a strategic and holistic approach, we can overcome the challenges and fully realize the potential of IT systems to improve health and well-being. Thank you.